Patient PL is a 46-year-old female who was admitted on 9/22/18. She is a full code status and is on no isolation or precautions. Her diagnosis is chronic migraines. Her length of stay is 1 day. Her diet is regular and there are no supplements. She has no known allergies. The patient has had consistent headaches lasting 2 weeks or longer for the last several months. Patient has been treating herself with Excedrin every day for the past 2 weeks. Patient stated that she is concerned about her headaches and wanted to come get it checked out. She stated she doesn't know her biological family history. She has no history of surgeries or procedures. Her weight is 165 pounds and her height is 5'5". She is still awaiting the results from her labs, and her vent O2 is 100% room air. Her diagnostic orders include CT scan, and her vitals include 138/90 for her blood pressure, heart rate of 98 beats per minute, respiratory rate of 18 breaths per minute, and temperature 99.8 orally. Her pain is rated as a 7 on a 0 to 10 scale, and she describes it as constant, dull, and the headache is all over her head. She has a normal sinus rhythm, no incisions or wounds, and no tubes or drains. She is independent and up as needed. She has an IV in her peripheral left antecubital 20 gauge saline lock. The patient is a 46-year-old white female admitted 9/22/18 with a headache that the patient stated and described as constant dull and a level 7 pain all over headache. The patient stated that she has had this headache for at least 2 weeks or longer and has lasted for several months. She also stated that she has become very concerned and decided to come in to get it checked out. She has been treating the headache with over-the-counter Excedrin. She also stated that nothing she does really makes the pain better or worse. She has no other health problems, and the patient gets 6 to 8 hours of sleep per day, doesn't smoke, has 2 to 3 cups of coffee daily, drinks occasional alcohol, minimal exercise, a well-balanced diet, and she stated she probably doesn't get enough water daily. Patient states she doesn't know her biological family history. Patient is alert and oriented ×4. Her heart sounds are regular, lungs are clear bilaterally, all pulses were felt, +4, skin color normal for race, skin warm and moist, no edema, bowel sounds heard in all 4 quadrants. She lives at home with her husband. Physical assessment 200 level. The nurse will begin by knocking on the door and introducing herself and explaining what is going to be done today.
Hello, my name is LaCrista. I'll be your nurse today, and I'm going to perform a head-to-toe assessment on you. Is that okay?
Yeah.
Okay.
Then she will wash her hands and identify the patient by checking the name, date of birth, and medical record number.
Okay. So to get started, could we start by verifying your name and date of birth, please?
It's Pam Litka, 12/23/71.
Thank you.
She will then see if the patient is alert and oriented to place, time, and situation.
All right, Pam. Do you know where you are right now?
I'm at the hospital.
Okay. Do you know your reason for being here?
I have a headache.
Okay. Do you know the time or the day?
Is it Wednesday around 12?
Yes. Thank you.
Then she will assess the pain, its characteristics, by using a 0 to 10 scale, 0 being no pain at all and 10 being the worst pain ever.
Are you experiencing any pain right now?
Yes,
Okay. Where's the location of the pain?
in my head.
Okay. On a scale from a 0 to 10, 0 being no pain, 10 being the worst, what would you rate your pain?
7.
Okay. Could you kind of explain some of the characteristics of the pain?
It's kind of a constant, sharp pain.
Okay.
Then she will ask if she has any allergies.
Pam, do you have any allergies?
No.
Okay.
Then the nurse will assess the IV site, noting the location, size, and start date, and if it is saline locked or infusing. She will also view the dressing, noting if it is clean, dry, and intact, or if there is dried blood or old drainage. Then she will obtain the vital signs, including blood pressure, heart rate, respiratory rate, temperature, height, and weight. After obtaining the vital signs, the nurse will don a new pair of gloves. She will then explain to the patient that she is going to be touching the head.
All right, Pam, so this head-to-toe assessment does involve me touching your hair. Is that okay?
Yeah.
Okay.
The nurse will be inspecting for any bruising, tenderness, lacerations, abrasions, bumps, or the presence of lice. Then she will wash her hands and put on a new pair of gloves. Assessment of the maxillary sinus by palpation is to determine whether the patient is experiencing any sinus pain or pressure.
Do you feel any pain or pressure?
No.
Moving on to the eyes. The nurse will ask if the patient wears glasses or contacts, has had any eye drainage or pain, and if they have ever had eye surgery.
Pam, have you ever had any eye surgery?
No.
Okay. Do you have any drainage or dry eye or any pain of the eyes? Do you wear corrective lenses?
No.
Okay.
Next, she will assess Perla. Are the pupils equal and round? Are they reactive to light? Right now, the nurse is looking for the consensual response. When the light shines into the left eye, constriction of the right pupil will occur as well, and vice versa. Then she will assess A in Perla, or accommodation.
All right, Pam, so if you'll just stare at the tip of my pen light, and I'll just move this in closer, okay?
Then she will assess vision with the Snellen chart. This assesses cranial nerve number 2, or the optic nerve.
Pam, could you read line 3 for me?
Yes. TOC.
Thank you.
Next is the assessment of extraocular movement, or cranial nerves numbers 3, 4, and 6. 2 and 7 o'clock indicates cranial nerve number 3, or the ocular motor nerve. 11 and 5 o'clock assesses number 4, or the trochlear nerve. And 3 and 9 o'clock is number 6, or the abducens nerve. Next, the nurse will move to the ears. She will assess to see if there is any drainage, pain, surgery, or if the client has hearing aids.
Pam, do you have any hearing aids?
No.
Do you ever experience having any drainage or anything out of your ears?
No.
Okay.
Then she will test number 8, cranial nerve, or the acoustic nerve.
Pam, let me know when you first hear the sound of my hand.
Yeah.
I'm gonna do it this way too.
Yeah.
Thank you.
Moving on to the nose. The nurse is looking to see if there is any deformity, drainage, a deviated septum, if the patient has a good ability to breathe, or if they have ever had surgery.
Any surgeries on your nose?
No.
Okay. Any drainage, abnormal drainage?
No.
Okay.
Then she will test the number 1, or olfactory nerve, by asking the patient to smell something.
Pam, I'm gonna ask you to smell what I have in my hand, and you just tell me what it is, okay?
Okay. It smells like deodorant.
Okay, thank you.
Then the nurse will check in the patient's mouth. Does she have any dentures? Are there any sores in the mouth? And are the mucous membranes pink and moist?
All right, Pam, could you say, open your mouth for me, please? All right. Do you have any dentures?
Mm-mm.
Okay. Any pain?
Mm-mm.
Okay. Mucous membranes look great.
Then she will test the number 5 cranial nerve, the trigeminal nerve, by asking the patient to clench the jaw, and the number 9 glossopharyngeal nerve by asking the patient to say ah.
Pam, could you please clench your jaw for me? Okay, thank you. And could you say ah as well? Thank you.
Then the number 7, or facial nerve, is tested by having the client raise the eyebrows.
Pam, could you raise your eyebrows for me, please? Thank you.
Then the number 10 nerve, or the vagus nerve, is tested by instructing the client to swallow and then speak.
All right, Pam, could you please swallow and then speak for me?
Yeah.
Okay, thank you.
Then The number 11 or accessory nerve is tested by having the patient shrug their shoulders.
Pam, could you shrug your shoulders for me? Great.
Number 12 or hypoglossal nerve is tested by asking the patient to stick out their tongue.
Pam, would you be able to stick your tongue out for me, please?
Yeah.
And move it around? Thank you.
Next, the nurse will assess the neck, inspecting to see if the trachea is midline. She will also look to see if there is any presence of JVD or edema.
All right, Pam, I want to stand at the edge of the bed and just check and see if you have any jugular vein distension.
Next, she will palpate to feel any swollen lymph nodes. Are the carotid pulses bilateral? It is important that she does not check these at the same time so that the blood supply to the brain is not cut off. Posterior breath sounds in all 6 locations, asking the patient to take deep breaths and blow out the candle, assessing for any crackles, rails, or wheezing.
Every time I place a stethoscope on your chest, could you take a deep breath and blow out the candles? Thank you.
Next, she will assess the heart sounds, the aortic or right mid-sternum, second intercostal space, pulmonic, left mid-sternum, second intercostal space, Erb's, third intercostal space, left mid-sternum, tricuspid, fourth intercostal space, left mid-sternum, and the apical, fifth intercostal space, midclavicular line, and she will listen to that for 1 full minute. Moving on to the breast exam. The nurse would ask the patient if they perform a self-breast exam. If so, when and how they perform it. The nurse would then fill in any information needed and answer any questions the patient might have. It is important for the nurse to ensure that the patient inspects the breast once a month right after her menstrual cycle. This can be done in a warm shower while lying in front of a mirror. Teach the patient to look and feel for any masses, any retractions or dimpling in the skin, and to look for any localized hypervascular areas or any edema. The nipples should not have any drainage unless breastfeeding or pregnancy.
Pam, do you know how to perform a self-breast examination?
Yes.
Okay. And when do you usually perform that examination?
I usually do it once a month, when I'm in the shower,
Okay.
after my period.
Okay.
The nurse will then inspect the abdomen for distension. She will auscultate bowel sounds starting in the right lower quadrant, listen until a sound is heard, then move to the upper right quadrant, to the upper left quadrant, and then to the lower left quadrant. Then the nurse will palpate in all 4 quads for rigidity, pain, tenderness. Then the nurse would ask the patient if they have gained or lost weight, if they had any nausea or vomiting, and when have they had their last bowel movement. The nurse would ask the description of the patient's stool.
Do you feel any pain or tenderness when I press on your stomach? Okay, thank you. Are you experiencing any nausea or vomiting?
No,
Have you had any unplanned weight gain or weight loss?
no,
Okay, when was your last bowel movement?
this morning.
Okay. And what were the characteristics of it?
It was formed and it was pretty normal.
Okay.
Moving on to the genitourinary. The nurse would ask the patient about their urination, if they have any difficulty urinating, the frequency of it, and if there is any pain or burning. If the patient has a Foley, the nurse would measure the urine output, secure the catheter bag, and clean the drainage tubing.
Pam, do you have any difficulty urinating?
No.
Okay. Are you going more or less here lately?
No, it's been pretty regular.
Okay. And when you urinate, is there any pain or burning
No.
sensation? No. Thank you.
The nurse would then ask the patient if they are sexually active, and if so, ask if they are practicing safe sex. For female patients, the nurse would ask about the menstrual cycle or menopause, and GTPAL, or gravida, term, preterm, abortion, and living. And this is to assess the patient's previous pregnancies.
Pam, are you sexually active?
Yes.
Okay. Are you practicing safe sex?
Yes.
Okay. Are you having any symptoms of menopause or?
No.
No? Okay. And how many pregnancies have you had in the past?
2.
Okay. How many of them are living?
2.
First, the nurse will inspect the arms for any abrasions, lacerations, bruising, or the presence of breakdown. She will then palpate the arms, noting any signs of tenderness, deformity, or edema. She will also pinch the skin to check the skin turgor. Skin turgor is an indicator of hydration status. If the skin returns to normal after pinching it, the patient is well hydrated. The nurse will then check the radial and brachial pulses, noting if they are 1+, 2+, 3+, or 4+, 1 being the weakest and 4 being the strongest. She will also check the capillary refill, taking a finger and pressing the nail bed of at least 3 fingers on each hand. This is to assess the circulatory function. The nurse will also note the skin color and temperature. Then she will have the client perform range of motion exercises and grip strength.
Pam, could you please extend your arms out for me? Okay. Did you go sideways as well? Okay. Great. Could you push my hand away from you? And could you pull them back towards you? Okay. And could you grip my fingers with both hands? Thank you.
Moving on to the lower extremities. The nurse will also check the legs for any abrasions, lacerations, bruising, or the presence of breakdown. She will palpate the legs, noting any signs of tenderness, edema, or deformity. She will also check the capillary refill in the toes, the skin color, and temperature of the legs and feet. She will palpate the femoral, popliteal, posterior tibialis, and dorsalis pulses bilaterally. She will have the client perform range of motion exercises in the legs.
All right, Pam, could you please bend both of your legs for me? Okay, and then just could you lift them up straight? Okay, thank you.
And she will have the client perform plantar flexion and extension.
Could you please push my hands down like you're mashing the gas? Okay, and then pull them back towards you. Thank you.
Then she will assess the gait if the client is ambulatory.
Pam, would you be able to stand up for me, please, and just walk a couple steps and then come back? Thank you.
Moving on to the posterior. She will check the backside for abrasions, lacerations, bruising, and breakdown. She will look for any tenderness, deformity, or edema. Then she will auscultate the lungs on the posterior side, having the client lean forward. And that concludes the Nursing 211 physical assessment. Thanks for watching.